Lung cancer is the leading cause of cancer deaths in the United States. It takes more lives each year than breast, colon, and prostate cancers combined. Some people with advanced lung cancer never receive cancer care. Perhaps it's because they think there's just no hope. Stage 4 cancer survivor Don Stanathan joins us this morning, along with Dr. Praveen Chenna, who works in interventional pulmonology at Washington University in St. Louis. Good morning to both of you.
Good morning.
Doctor, what are the signs and symptoms of lung cancer?
Great. The signs and symptoms of lung cancer can include persistent cough, shortness of breath, chest pain, coughing up blood, or even weight loss. But really what's alarming is many patients don't present with symptoms until advanced stage disease. As a result, in order to bring awareness to lung cancer and Lung Cancer Awareness Month, I've teamed up with Genentech to provide this message.
Don, we'll get to your message to other patients, but I'm curious about your personal experience. How did you know something was wrong, and then what did you do once you were diagnosed?
Mary, I was doing volunteer work at an institution in California that required that I get a routine chest x-ray once a year to check for tuberculosis. And what they identified on that x-ray was a spot on my left lung. And so my pulmonologist, like Dr. Chenna, continued to watch that spot, and they noticed after a few months that the spot was growing. And so they scheduled some other tests and procedures, and then I found an additional hot spot in my right lung, which ended up, it was a tumor. And so my pulmonologist immediately scheduled me for radiation so that they could shrink that tumor down so that it didn't collapse my lung. And that was followed by chemotherapy and Avastin, and again, then followed up with an oral medication, Tarceva, which I'm still on today.
And Don mentions a couple medications here. I think it's important to realize while they have their benefits, they also have their side effects. So obviously talk to your physician or your oncologist that's helping manage that.
Why aren't more people getting care, especially when they know they need it, they know they have cancer, so why aren't they seeking care, doctor?
Great. One of the reasons I think people don't seek care is the stigma associated with lung cancer. I think they feel when they get a diagnosis, and oftentimes it's at an advanced stage, that there's no hope. What has been great is we've come a long way in the last 10 years, 5 years, and so not only have we learned more about lung cancer, we've learned more about the ways to treat it, the types of lung cancer, and then the advanced therapies that are out there. When somebody is diagnosed with lung cancer, they should ask their doctor to refer them to an oncologist, so that's somebody that specializes in treating lung cancer. And those options and side effects should be discussed, as well as a team should be formed. And so what happens is, just like Don had mentioned, there are multiple physicians that are involved and specialists to provide the best care, and that can include surgeons, interventional pulmonologists, and even radiation oncologists. So it's a team approach, and that we know provides the best outcome. And
before we let you go, a website in case our viewers would like to learn more this Lung Cancer Awareness Month?
Sure. I think the website you could use is lung.org. It's the American Lung Association. You can use their resource, as well as the local and regional associations, as well as talk to your doctor, either your primary doctor or the physician, the oncologist that you've been referred to.
Gentlemen, thank you both for joining us today.
Thank you.
Great. Thank you
for having us.
Stay well. Mike.